Let me share a couple of stats with you. 13 is the average age that teens first use drugs and alcohol. That's pretty disturbing. And get this, 9 out of 10 addiction issues start in the teen years. That's the problem. Now, there is a solution, and it's called RIZE Prevention. It's a great program, a nonprofit here in the upstate. And what if I told you that teens, 85% of the students who participate in the RIZE Prevention program say that they would like to be drug free? With us today on our guest line, Martine Helou-Allen, who is the founder and executive director of RIZE Prevention. Martine, it's always a pleasure.
Yes, thank you so much for the opportunity to be with you today.
Well, thank you for what you do. Let's talk about it. And I see where 72%, and I'm getting this from your website, 72% of teens turn to drugs before high school graduation. That number should bother everyone who is listening to us today. Let's talk about the problem first, and then let's get into what you guys are doing to solve that problem.
Sure. So yes, that's it. 72% of teens who are going through something. Listen, kids, when they're young, they think with their emotions, right? And so in order for them to feel better, they turn to different things that are unfortunately many of which are destructive. And so what you see is that that number is a reflection not of kids that are necessarily addicted and can't go a day without using substances, but those are teens that have turned to substances and are experimenting with that before they graduate high school. And so what we're seeing is that this is coinciding also with the rise in anxiety and mental health issues among young people. And a lot of times people don't understand that drug use and substance use is actually a mental health issue. It's just coming out as drug usage. Whereas there's other behaviors like self harm, like pornography, gambling is also on the rise. So at Rise, we talk about the drugs, but we also talk about the other addictions that could come along with it. And so you're seeing that kids just, they're not able to cope. They don't know how to cope. They're not self regulating. And so they're turning to self medicating with drug use and other addictive behaviors.
Wow. I'd never thought about the other addiction issues out there. And I guess it's just so different now than when I was a kid. We didn't have the internet like we do today and weren't exposed to so many things. And, Martine, I just can't get the idea out of my head that 13-year-olds are using drugs at times.
Joey, try this. We've got fourth graders that are vaping.
Wow.
We're
Wow.
already being asked by elementary schools to go and give our program because they're starting to see this among elementary school students.
Yeah.
I went and I did a presentation at a local elementary school here last year. And it was just a career day thing that I went and I love doing that kind of stuff. And when I talked about what I did, there were a couple boys in one of the classes that started crying and told me that they had been vaping.
Wow.
And see, it was shocking to me. And more than that, it was heartbreaking to
Yeah.
think that they didn't get that out until some lady with a drug prevention addiction prevention program came to their school for career day. So imagine how many other kids are silently struggling.
Yeah. Wow. Martine, for decades now, we've talked about eliminating drug abuse. I mean, you can go back to the 80s and First Lady Nancy Reagan's Just Say No campaign. Have we made
Mhm.
any progress, or do you think it's worse today than it was back then?
Um, the evidence has shown that we have not really made progress. The evidence has shown that the Just Say No approach and the old Dare approach did not work, because that's not how you influence decision making and changing behavior among young people. We also have a different kind of environment where there is so much more accessibility to substances. And you've got people that are manufacturers that have figured out the loopholes to being able to put things out on the market that are absolutely addictive, okay, but yet don't have any, policies related to them. Like, for instance, Delta 8. Delta 8 is considered Delta 9, Delta 10. You can have that in a store. There's no problem with that because it doesn't become active as a drug until you heat it.
Yeah.
So
All right.
there's a lot of different things there on the market that basically, are there available and there's no policies related to them.
All right. Go into a little more detail on that because honestly, I don't know what Delta 8 is. What is Delta 8?
So it's a form of like marijuana that is sort of engineered in a way to where it's still legal in its pure form.
Yeah.
So basically,
Okay.
people are smoking Delta 8, Delta 9, 10, or they're putting it in their vapes. And so that does not become active, and the THC is not released unless it's heated.
Okay.
So it's
Okay.
basically like marijuana, but it just in a different form.
Wow. On our guest line today, Martine Helou-Allen is with us. She is the founder and executive director of RIZE Prevention, a great organization. We're going to talk a little more about RIZE Prevention and what they're doing because, Martine, we've kind of talked about the problem here, and it is a disturbing problem. And again, anyone who has kids, grandkids, or anyone just concerned, this has to trouble you to know that this is going on in our schools and in our community. But you have a solution to this, and your organization has been very successful. RIZE Prevention. Talk about your program and what you're doing to break this cycle.
Sure. So my program is all about the innovative way to approach drug and addiction prevention among youth. We looked and we researched and we studied about what wasn't working. But then we also did the research about what does work. And so what RIZE Prevention has essentially made and created is the RIZE program, which is a school-based comprehensive drug and addiction prevention program for youth that focuses on how young people make decisions, what influences their behavior. And so therefore what we learned is that you can't just approach kids with a curriculum and say, okay, this is what marijuana does to you. This is what vaping, this is what alcohol does to you, and expect that, right, to change their behavior. That's not what motivates them to do what they do. What motivates them is having their emotional needs met. What motivates them is how do they deal with past trauma? How do they deal with adverse childhood experiences in a constructive way, right? That's what we're trying to do. In addition, teens make decisions based on their peers. So we know that we can't just have a program that deals only with changing individual behavior. We had to come up with a program that will also change the cultural norm in their community. And kids' communities at the end of the day are their schools.
Yeah.
And so, how do we do that simultaneously? So, that's what iRise is about. And we focus very, very strongly on the mentorship aspect of changing behavior. So, people want to be loved and valued. People want to feel like they belong. People want somebody ultimately to believe in
Yeah.
them. And so that's what motivates decision making. And so when you get that trust in the relationship with those kids to get down to the heart of what's bothering them, right? What they're self medicating, then you have a very, very high chance of changing the behavior or preventing that behavior from starting by getting to the root of why they do what they do.
Yeah. My guest today is Martine Helou-Allen, the executive director of RIZE Prevention. I think back to when I was in school. It's a long time ago. We won't talk about how
Me
long.
too.
But you're so right. You always have the cool kids in the school, and so that mentoring approach, I can see how that would be very effective if you have some influencers who just say, look, drugs, alcohol is just not cool anymore.
Yes, and you know what? The funny thing is that kids are just shocked when they see that most of them are not
Yeah.
participating in these behaviors. And what's really nice is that we're in schools, we start in the sixth grade, then we do another version of our program in seventh grade, and then another one in eighth grade. So when we get into a school, these kids have us for 3 years. What is so beautiful for us is when the eighth graders who had our program starting in sixth grade come to us and say, how can I help you in communicating to the sixth graders? And
Yeah.
so they become like our internal ambassadors, if you would, for our program. And then we also have high schoolers that come from the high schools that, feed are fed to by those middle schools. And then they come back and they're pouring in to these young people. And so what we're seeing is that, yes, indeed, we are gathering the data that we are changing what is considered culturally acceptable and socially normal in the schools where we are. And of course, at the end of the day, what we're trying to do and what's happening is that we are fostering an environment where the opinion of young people is trending toward, I don't do drugs. I'm not going to get involved in these addictive behaviors because I'm more self aware. And I know that having those behaviors come into my life is number one, not going to help me. And number two is going to keep me from achieving my purpose in this life. So that's what we're really cultivating here at the schools. And the other thing that's happening simultaneously, which science has proven that this is true, that correlation between abstaining from drug use and addiction is having a very positive effect on increasing academic engagement of students. It is decreasing the truancy, decreasing the suspensions and violence. So it's a win-win all over.
Yeah. Yeah. Wow. For additional information on this great program, visit their website, rizeprevention.org, rizeprevention.org. Of course, it has all the details of what they're doing in the schools. And also, you can see how you can support this program too, because it does cost money for these programs. And Martine and her team could certainly use your support. How many schools are you presently active in, Martine?
So going into the 25-26 school year, we will be in 21 schools and we
Wow.
have schools on the waiting list. So I may take on 24. It
Yeah.
depends on if I can get the staff to do that and to handle that because of how we split into teams because we're in schools for 4 months at a time, Joey.
Yeah.
It's not just a one and done presentation. So we have teams of liaisons that are dedicated to those students, which, works, but it also, like you said, takes money in
Sure.
supporting that kind of interaction with kids. And yes, we do need the public support. We unfortunately lost some earmarked appropriation funding this year. And it's not lost on me that the government can't fix this problem. I know
Yeah.
that law enforcement can't fix this problem. It's our communities that need to fix this problem. So we would love to engage the community in helping us to provide youth with this program and make sure that every school that wants our program gets our program.
Yeah, as it should be. I mean, I'm just sitting here thinking when you said you're in 21, possibly 24, I'm thinking, why is this not in every school?
Yeah, that's, you know what? Absolutely. And
Yeah,
I think it's because our model is so innovative that schools just they're they don't know, they're not sure like how to implement it. They've got a lot of pressures on them just from the curriculum standpoint, curricular standpoint of having to achieve all of these academic benchmarks that I think that they want to hear from their colleagues about how well this program does and how much the work they don't have to put into it that's very easy to implement. And honestly, Joey, that's how we've been able to spread so fast. We've
yeah,
only been working. We started in June of 21, so that means August of 21. We started with only 4 schools.
yeah,
Look where we are now, and it is because of that word of mouth from principals and administration about our program to their colleagues that is really the reason why we've grown so
yeah,
much.
yeah. Martine Helou-Allen is executive director, founder of RIZE Prevention. If what you have heard today if you think this is important and you would like for your child's school or your grandchild's school to have this, check with the school, check with Martine's. You can reach her through her website, riseprevention.org. And Martine, let's say there's a parent who's listening today and they find out that their school, their child's school does not have your program. How could they potentially see that they do get the program?
Well, they've got to advocate to the principal and administration for that and just say, this is important to us. We need this. But the other thing that we do outside of giving our program to schools, let's say that there's a parent that, has a child who's in need. We do certified one-on-one coaching with
Hmm.
kids who either need early prevention or something has happened to where proactive intervention is necessary. We serve everyone. So you don't have to be in a school where we're at in order to get our one-on-one coaching. And Joey, we are good at
Yeah.
that,
Wow.
especially when parents are not afraid to say, you know what, my kid has a problem. Because you know what, your kid's not the only one. And the most dangerous thing that parents can say is not my child.
Right.
We live
Exactly.
in a world today where you do not have that luxury of saying that. In addition, we do a lot of things throughout the summer as well. We do a lot of things throughout the school year, different activities. So do get on our social media because you can see other opportunities for your students to get connected with our team.
Right.
and be poured into in a great way, be positively influenced. Even if we're not at your school, we got plenty of things that are available for you
Yeah.
and your child.
Well, and if someone obviously you need donations, you need the financial support, but if
Yes.
someone would like to be involved too, I mean, is there an opportunity for volunteers as well?
Yes, there are opportunities for volunteers. We can have volunteers to help us go and fundraise. We can have volunteers that help us schedule different presentations. Rotary clubs have been so amazing for us. Just that volunteer of connecting us with others that could help us, even if it's somebody that wants for us to come into their community. And we're
Right.
like, we've done plenty of presentations at like people's homes and at community clubhouses. That would be wonderful. Just helping us get more awareness out into the community about what we're doing. But more than that, to reach people who may need to hear our message because it could literally be life saving and life changing
Sure.
for them and their
Yeah,
families.
absolutely. Yeah. Again, that website is riseprevention.org. Go online, see the good work that Martine and her team are doing in our schools, and reach out to help, whether it's volunteer, financial support. If you'd like Martine to come speak to your group or your community or whatever, she or one of her team members would love to do that. Martine, thank you again for what you're doing in our community, and good luck to you in the coming school year.
Thank you so much, Joey. I appreciate you because you have always been consistently supportive and a great encourager for me. So that matters. And I really thank you for using your platform for good, and to bring awareness to organizations like mine who definitely need the public's help. But, you got to have a passion for people to do that. And I really appreciate what you do.
Yeah, well, thank you so much for your kind words. It's always a pleasure, and we'll have you back again soon.
Thank you.